Hello, and welcome to our presentation. This project was created by College of St. Benedict and St. John's University senior nursing students, John Von Bank, Kelvin Burg, and Isaac Dubois, in collaboration with nursing professor Jody Burns. This presentation will cover the impact of rapid sequence intubation virtual simulation on student confidence level regarding junior and senior nursing students at the College of St. Benedict and St. John's University. With all three of us being interested in critical care practice, this provided an opportunity to learn and explore the side of nursing. Because of this, we chose an area of critical care that is both common and important to have a strong foundational understanding for: rapid sequence intubations. We sought to not only teach on this topic, but to enhance the retention of the information for the students. This led to the expansion of our project to discuss and evaluate student-developed teaching modules. For our purposes, we decided upon a virtual formatting of our project to increase availability and accessibility for students. According to Pat Healy et al., clinical virtual simulation can be utilized as a teaching model that facilitates knowledge retention, clinical reasoning, increased satisfaction with learning, and improved self-efficacy in nursing education. This research on clinical virtual simulations supported our reasoning for doing this project. We sought to utilize these findings and further test them by creating a pair of pre- and post-surveys to offer to the junior and senior nursing students as a means of assessing the effects that the education and simulation had on the confidence of the students. Developing virtual simulations can be labor-intensive for faculty. To overcome the challenge of limited faculty time and workload constraints, we created this project. The virtual simulation was intended to provide education on the topic of rapid sequence intubations for undergraduate nursing students with an interest in critical care. As many nursing programs are reducing the critical care content in their curricula, in order to prepare students as nurse generalists, new graduate nurses are still being hired in critical care positions upon graduation, and virtual simulation could be used to help bridge the academic practice gap and increase confidence. In this study, students completed a survey before and after their participation in the virtual simulation to assess their perceptions of self-confidence. To create as authentic of an experience as possible, we closely collaborated with Thomas Miller and nursing faculty Jody Burnt, both experienced critical care nurses. With their assistance, we used the American Association of Critical Care Nurses guidelines to develop a patient situation that indicates an RSI using evidence-based practices. In addition, we reviewed hospital policies to examine potential policy differences. Throughout the development of this simulation, we actively collaborated with Jody and Thomas, receiving feedback to create the highest quality presentation possible. The developed simulation is composed of three main sections: education, demonstration, and retention. For the education, we defined what a rapid sequence intubation is, what equipment is utilized, indications, medications, and the primary nurse's role in the procedure. This education is a recognition of the lack of didactic in typical nursing programs on certain aspects of critical care nursing, and seeks to provide an introductory approach for nursing students with an interest in critical care. The demonstration segment of the simulation included videography of the procedure while displaying the preparation and intubation process, as well as post-intubation care of a patient. Video segments were embedded into a PowerPoint document, followed by cuts wherein retention questions were utilized. For this section, we developed a patient care situation that nurses could realistically encounter in a critical care setting. The patient's story involved a case of acute respiratory distress syndrome following a pulmonary infection and an inability to continue to maintain their airway independently. The retention portion of the simulation was addressed through the inclusion of several multiple-choice questions that were integrated within the simulation experience. The questions allowed for assessments of student knowledge of the procedure. Similarly, the questions reinforced knowledge of the procedure by providing a typed rationale about the correct answer and address gaps in knowledge by redirecting students if they answered incorrectly. We submitted the proposal for our project to the International Review Board of the college and university and were approved. The results were collected anonymously and no identifying information was collected during the study. We collected 23 responses on the pre-survey and 19 on the post-survey. We collected the data from the surveys and separated the responses into pre- and post categories. Once this was done, we calculated the average for each of the 5 questions from the surveys. This allowed for the comparison of the confidence level from prior to completing the virtual simulation to after. The average confidence rating was 1.5 on the 1 to 5 point scale across the 5 pre-survey questions, whereas the average confidence rating for the post-survey was 3.4. There was an average increase of 1.9 on the rating of perceived confidence level on the post-survey questionnaire. The question assessing confidence level in the skills required for an RSI had the largest increase of 2.4 points. Anticipating complications recorded the smallest increase in confidence at 1.2 points. This means that 30% of the students that participated had some form of experience. This likely explains the lack of a significant shift in some of the responses due to varying levels of confidence due to prior involvement with an RSI. With the results of the survey, we concluded that the education and virtual simulation aided in the overall learning of the students and enabled them to have some groundwork for understanding an RSI. Furthermore, it corroborated with the previous studies as suggesting the potential for student-developed educational models as an effective learning tool and a resource for professors in the progression of the curriculum. This could lead to a decrease in cost for nursing programs due to decreased demand on professors. In addition, it acts as a method of reinforcement for the students involved in the development of the modules, increasing knowledge and enhancing retention of the information. If further studies are developed utilizing similar models, we would suggest an expansion of the test group to determine greater statistical significance and include other topics related to student interest. Due to the nature of the nursing program and class size, this may be difficult to attain and may continue to limit sample sizes, but this could be further studied at larger institutions. In addition, follow-up studies could focus on the presentation of the virtual simulation prior to a scheduled in-person simulation to allow the students to physically demonstrate both the knowledge required and demonstrate the competency in the performance of the necessary accompanying skills. The development of this virtual simulation was an exciting opportunity for us to craft something which the College of St. Benedict and St. John's University could utilize to enhance their established curriculum. It also enabled access to unique experiences that not all undergraduate students are able to experience, such as working to obtain study approval from the International Review Board, handling equipment related to an RSI, performing an RSI on a mannequin, developing teaching models for the nursing students, and crafting a survey model to accurately report the responses. The utilization of resources such as the AACN policy and procedures allowed us to practice clinical inquiry skills to inform practice. As a result of this project, we hope to aid in reducing the academic practice gap and assist with the ease of transition to professional practice. We are thankful for the opportunity to present at the 2023 Wisconsin League for Nursing Spring Conference. We are immensely grateful for the collaboration, inspiration, and dedication of nursing faculty Jody Byrne and RN Thomas Miller. If you have any questions or comments, please do not hesitate to contact us at the listed emails. Thank you again for listening.